Welcome back, guys. Today we are going to see dehydration. Dehydration is lack of water in the body, or when the water leave your body, or is when the body loses more water than it can be replaced. What are the causes of dehydration? Dehydration can be caused by not drinking enough water. And this can be due to exercise, sickness, when you are busy, or if you are not having safe water to drink. Then we have passing loose watery stool. This one is 3 or more motion in a day. And we have profuse vomiting. This one should be profusely. If someone is vomiting everything, that's what we call profuse vomiting. And then we have high fever. The more the fever is, the more dehydrated someone will become. And then we have excessive sweating. This is mostly during exercise, as you can see here. Mostly during exercise, hot weather, and all those ones. And then we have increased urination. This one can be due to drugs or diseases, can make you to pass urine more frequently. Drug like Lasix can also make you to over-urinate. And then we have burns. Some surgical conditions like eye or peritonitis, weather, mostly very hot weather. This one can lead you to sweat profusely, and at the end can cause dehydration. Signs and symptoms. These are the signs and symptoms of dehydration. 1. Sunken eyes. If someone has sunken eyes, that person has dehydration. We have skin pinch, go back slowly. Mostly, if you can see this, it will go back very slowly, like this one here. See how it is? That is what we call the skin pinch, go back very slowly. And then we have dry mouth and dry lips, dry tongues. Those ones also, so that you have no. Then we have no tears when the child is crying. That one's also a sign of dehydration. Irritability. Someone is restless, irritable. Mostly this one is severe dehydration. And then if you pass the urine and your urine is concentrated and having a very strong smell, that's also another sign of dehydration. Passing little urine, and that little urine will also have strong smell. If you're feeling tiredness, when you know that you have oversweated after doing exercise, which means you are dehydrated, you need to take water. Headache. We have tachycardia, increase heart rate. Tachycardia is another sign of dehydration. In children, those one where the frontal is still, then you'll see the frontal will be sunken frontal. And then history of passing loose watery stool for 3 or more motion in a day, or profuse vomiting. That one also drive you to dehydration. Thirsty, the person will be thirsty, and if you give something or some water to the baby or the person will be eager to drink. And in malnutrition, the visible vein, mostly the superficial vein, will collapse. You will not see this. This one is to nurses. When you are cannulating a dehydrated person, severely dehydrated person, the backflow will be very slow. So those are the signs and symptoms of dehydration. Then how do we manage dehydration? Treatment of dehydration need water into the body to be replaced, and you need to give plenty of fluid orally if the person can take. And if the child is breastfeeding, you continue breastfeeding. Give ORS. If a child is malnourished, you need to give paracetamol to the baby. Don't take overdose of diuretics. Then give IV fluid if the person cannot take, or pass NG tube and give through NG tube. Always go for medical checkup for ruling out some diseases like diabetics. In summary, dehydration is when your body lack water, causes, you say, not drinking enough, exercise, sickness, too busy to take water, or not having safe water to drink, passing loose stool, 3 or more motion in a day, vomiting, fever, excessive sweating, increased urination, burn, surgical conditions like IO and peritonitis. Very hot weather can also make you to be dehydrated. So what are the signs and symptoms of dehydration? We said sunken eyes, skin pain go back very slowly, history of vomiting profusely, passing loose stool, 3 or more motion in a day, the person will be thirsty to take, visible vein collapse in malnutrition, not drinking enough water, and the person will be eager to take, and then tachycardic. Then what are the treatment? We said you give fluid, continue breastfeeding, and give IV fluid if the person is not taking enough, and you give ORS, and in malnutrition you give paracetamol. That is all. Thank you for watching, and see you in the next one.